The role of inflammation in Alzheimer's disease was first recognized by Alois Alzheimer himself in 1907, when he saw that astrocytes and microglia were activated in the brain of his first pathology patient. Since then, there have been many studies in many laboratories that have shown that inflammation is increased by various criteria: cells being activated, proteins being expressed in the brains of people with Alzheimer's disease. The problem has been that correlation does not imply causality. And despite many studies that have tried to reduce inflammation with various interventions, they have all failed to improve the cognition in people with Alzheimer's. One of the clearest indications that inflammation might be involved in Alzheimer's disease clinically was the finding by several laboratories that people with rheumatoid arthritis tend not to get Alzheimer's disease. The protection is debatable, but it's somewhere between 3 and 8-fold. That had led to a large clinical trial to suppress inflammation with NSAIDs that failed. Then it was tried in MCI, thinking that people with rheumatoid arthritis have been taking NSAIDs their whole life, so maybe you needed to start earlier. But that trial was actually ended before it was finished because some people got worse instead of better. We took a different view, and that was that people with rheumatoid arthritis might actually express a protein or another molecule in their blood that was protective against Alzheimer's disease. We went searching for that, and to make a long story short, GM-CSF, or granulocyte-macrophage colony stimulating factor, seems to contribute to that protection. Because if you treat mouse models of Alzheimer's disease, their cognition is completely normalized by this treatment, as is their amyloid deposits in the brain reduced by 60% in just a few weeks of treatment. What we will be talking about in the ADPD conference is that a clinical trial, phase 2, placebo-controlled, double-blind, of GM-CSF in people with mild to moderate Alzheimer's disease resulted in an improvement in their cognition as measured by the mini mental state exam, and an improvement toward normal of the 3 major biomarkers of pathology: amyloid, tau, and UCHL1, which is a measure of neurodegeneration. The NIH has recently awarded us a grant to carry out a longer trial of GM-CSF in Alzheimer's disease patients. The first trial was only 3 weeks and showed improvement. This trial will be for 24 weeks, and we will follow up with a multitude of cognitive assessments, blood biomarkers, and brain imaging.